The Aspen Health Innovators Fellowship is a program focused on U.S. healthcare innovators. Anybody who knows anything about healthcare in America knows that it's very, very complex. There are very few places where leaders come together across the various sectors within healthcare. In the case of the Health Innovators Fellowship, we bring together really unique groups of people, and we feel that through that diversity of thought in the room, great ideas bubble up.
We have some of the best medical technologies and healthcare therapies, yet we have large swaths of the population that don't have access to basic healthcare services like prenatal care and dental care. We've never faced challenges like this before. So each year we choose 20 individuals, 20 leaders in the healthcare sector, and over the course of about 18 months, they attend 4 different seminars. Let them work with each other, take this personal journey that can really help them step up to the plate for the next half of their lives, to tackle the challenges, to stretch themselves, and to make the most out of this one precious life you have.
This Health Innovators Fellowship is really special, and it's hard to put into words. I started to see the people who are involved with this, and some of the great leaders and great thinkers and great doers, both in the US and also abroad. And it really made me think, well, you know what, maybe this is what I was meant to do. Maybe this is my time. I've always been interested in leadership and policy and making a difference. But I think it's hard for us to really feel that we're making a difference, day in, day out in our professional and also personal lives. So this really gives us a chance to generate new ideas and be able to extend this to a huge network, both, again, nationally and also globally.
The readings, the seminar discussions, the facilitated questions that you deal with, we're looking at these bigger issues around a good society and strong leadership and what we should do next in the world. This to me brings together a broad band of health people, but you're focusing on the bigger picture.
A very important component is the leadership venture. Every fellow is required to implement a leadership venture, which is an initiative that stretches and challenges them to step up to do something, to tackle a problem about which they feel passionately, and to do more than they ever thought they could to address that challenge. And that venture is something that lives on past the fellowship period, past that 18 months, and can evolve and grow.
My focus is on public health emergency preparedness, but more specifically working in communities, particularly communities of color, to figure out how to develop a neighborhood-based response strategy.
Developing a new therapeutics for treating Alzheimer's disease.
So my venture is focused on kids, middle school kids actually, getting them to understand the interaction between science and social change.
I've chosen to tackle as part of my venture and really growing from my experience here at the Aspen Institute, the issue of how do we use stories to transform hearts and minds and to make a difference on the topic that I care deeply about, racial and ethnic disparities in healthcare.
We really came together. It's 20 of some of the most accomplished academics, business people, policymakers, doctors, putting aside actually the different places we came from actually brought us together.
When I reflect upon the first meeting that we had, it's almost a similar experience I had either going to college or medical school, where you get into this room and you read people's biographies and you think, goodness gracious, how did I get here? These are really smart and powerful people. As you wind through the fellowship and you recognize so many different characteristics that maybe you are strong with and maybe that you're lacking, and gain strength from your co-fellows.
Really an amazing collection of people that I always learn from when I talk with them. And they do a really good job with the Health Innovators Fellowship about connecting us and making sure that we continue to connect, throughout the year, but also I think even after the fellowship is concluded, its 2-year term.
This group of diverse leaders will take their own personal journey and work together with leaders across the healthcare ecosystem toward the common goal of improving the health and well-being of all Americans.